The usual common problem, as well known to everyone, is the dental cavity. The soon that parents get to know there is a cavity, whether it's just a cavity or the cavity that causes pain, that's the main common reason brings children to the dental clinic. As little as a year and a half, or we say sometimes at the first teeth, they get them. As soon as they get the first teeth, we have to have a look at them, because a lot of children at night time they bottle fed, and we get the cavities as early as a year and a half. Sometimes we get patients, we get children about 9 years old, and they come with cavities. So the sooner the better. Like the first teeth they come out is the best time to see the children. Yes, but definitely. We always recommend about 6 months time. Why this 6 months time? This is the time sufficient for a cavity to form. If they find enough nutrition in the mouth, but they don't form big, they start to form in 6 months time. So this is the best time when they come. It's small cavity, we can deal with it quickly, and easy experience for the child. Definitely when they are about a year and a half, 2 years, up to 3 years sometimes, they are not very cooperative. So what we do is we let the child sit on the mother's lap or daddy's lap, and then we can do knee-to-knee examination while part of the body on the daddy's or on the parent's side, and then the head is on and the dentist's legs. So that gives an easy examination for these kids. But parents need to keep in mind that there won't be a good cooperation in early ages of the child. Well, every dental clinic is really equipped with necessary materials and equipments to treat children. And the technique, it differs from a dentist to another, but the majority of clinics are really designed to treat adults and children. On the other hand is the skill of the dentist treating the kid. Now, a lot of parents get confused between a cavity and the plaque layer. If there is a food accumulation on the front teeth especially, the first sign of cavity starts with the front teeth. So they get confused, they see it a yellowish discoloration on the top front teeth, and they think it's just food. The brown discoloration is the start of a major cavity in the future. So if you see any changes of color in the front teeth, that's a good sign for the parents to go and have a checkup. We need to minimize the sugar intake of these children. Now at young ages we can really control this sugar intake, but if we can minimize it like once a week, that will really prevent them from having a cavity. And definitely not forgetting to brush their teeth at night before bed. Now also, night bottle feeding after the age of 1 year and a half should stop, because this is a major source and cause of dental cavities in children. No bottle feeding at night. They can have milk during the day, but not at night time.
Not before bedtime?
Not bedtime. Bedtime, the last meal should be 2 hours before bedtime. The last meal a child should have 2 hours before bedtime. And no milk. A lot of parents complain that he doesn't eat anything, that's the only source for him is milk. We can't let him starve. No, if you prepare him from early age that you feed him well, not only milk, he will gradually stop feeding at night and definitely prevent the dental cavities. first, it depends on what sort of emergency. Now, if it's from, is it a trauma? It is, what is it, the emergency, is it from dental pain? Both ways we need to address the dentist or a pediatric dentist, because any dentist can see the children, but maybe not the proper treatment will be delivered by this dentist. So I would advise any parents who have an emergency first to seek an advice from a specialist, not a general practitioner. With respect to the general practitioners, but sometimes we get into advices not suitable for such emergencies. So a specialist would be the best to address at an emergency to avoid any complications in the future. Very essential, because a lot of trauma comes with sports, and we see broken teeth, badly broken, and when the teeth break, especially the top front permanent teeth, it's not a one visit fix. It's a really lengthy procedure to fix these teeth after trauma. So preventing them from happening is a mandatory. Easy,
quick
yeah.
fitting?
We can take an impression of the teeth and then we send it to the lab. Lab will fabricate a specific mouth guard for this child. You can choose whatever you like, yes. Usually designed for the back teeth, because the back teeth are made into a shape that accumulates food. So there are fissures in them, gaps, deep gaps. This gives a chance for the food to accumulate and then provide the shelter for the bacteria. Gradually, it ends up with cavities. So fissure sealing are preventive, easy, quick fix of the back teeth not to have cavities in the future. We all like sugars, we all eat. In fact, there is a cycle of the cavity to form. The four factors is, the first factor is we all have teeth. We all have normal bacteria in the mouth. We all eat. But we can break the cycle, and we all take sugars as well. So we can break the cycle by brushing well and flossing. So the shelter will not be provided. You won't provide enough time for the bacteria to grow, because normal flora or normal bacteria of the mouth is there. If you give them time to grow by not brushing, you're not breaking the cycle. So a lot of parents or a lot of adults come say, well, my brother does not brush at all and he has got really fantastic teeth. That's true. Sometimes the saliva of certain individual have antibacterial effect on the bacteria. So they don't brush, they didn't take care of their teeth, but still they have good teeth. So it's not related to them being careful. It's a gift, you know. Maybe you are gifted in being great mathematics. I don't like math. So this is a gift from God, so you can't control it. But again, those who do not have this special saliva effect, brushing, flossing is the best way to maintain the teeth. A lot of people floss. Flossing is a major issue. You are missing 35% of the tooth surface by not flossing. Rotten teeth, that's a good sign of poor hygiene. So rotten teeth need to be fixed as quick as they should be, because rotten teeth will end up with abscesses, bust discharge. So every time the child eats with a rotten teeth, they take bacteria down to their stomach. So the food is not clean as it should be, because the way of the food is not clean, so the food goes down to the stomach and cleaned. So cleaning them, preventing them, restoring them is the best solution to give a better health of the stomach. So rotten teeth, well, we have either we restore them and fill them and clean them if they are restorable. Restorable means we can fix them. In a non-medical term, we can restore these teeth and save them and keep them so the child can use them in the smiling, in the eating, in the chewing. Or if they are very bad, then we have to take them out to prevent further damage to the rest of the body. And they found a strong relationship between cavities and heart health. But children with cardiac problems, they need to have a very healthy teeth to prevent infection to the heart. I would recommend it, but a lot of parents are a little bit paranoid about fluoride because there is a lot of rumors of adverse effect of fluoride. Now, swallowing a whole toothpaste of 250 milligram still does not reach the toxicity that is necessary to cause damage to the living organs of the body. So a small amount of toothpaste with fluoride is not harming and very, very effective on preventing the cavities, as well as the fluoride, because the concentration of the fluoride is about 22,500 parts per million of fluoride in this amount of fluoride, and that gives a stronger teeth and definitely safe for the body. Very safe. Until 5% still safe. So you're doing a very good job for your children. Until they are 7 years old, 6 years old, they need to be supervised by the parents. At that age, they start to think they're old enough to let the parents help them. So I don't trust leaving kids with the age of 3 to 4 or 5 to brush by their own. Yes, we can give them a chance to brush, but definitely we need to repeat it again with them. First, to give them a chance to learn how to do brush and making sure that really brushing well. I don't recommend any toothbrush. Whatever suits, it's like personal preference. Pick the toothbrush you like, but don't pick a soft toothbrush. Medium toothbrush, whatever brand you like. There's so many brands, they're all the same. Until the age of 7 years old, we can go to children toothpaste that's a little bit flavored and the amount of fluoride is not too high. After the age of 7, we start to get permanent teeth, so we need more fluoride in the toothpaste, so we shift to the adult toothpaste. It's safer and better for the permanent teeth as well. There are two types of children with phobia. Both who we can manage to shift this behavior into more relaxed behavior in the clinic, and this takes plenty of visits and a lot of patience from the parents and from the dentist. Now, with this busy lifestyle, not all the parents have got time to come frequently to the dentist without doing anything, just to introduce the clinic. So if they are willing, so we have got a nitrous oxide gas that can relax the child a little bit so they can accept it. But the recommendations usually not below the age of 4 or 5, because we put the mask on the nose and the child needs to inhale it. And cooperative children who do not even sit in the chair cannot have this gas, because if there is a little bit of an anxiety, they can sit in the chair, they can inhale, yes, we can use nitrous oxide. If they cannot sit on the chair, we cannot give the child nitrous oxide. A lot of parents come with the question, I need nitrous oxide from my kid. He's about 2 years old. No way. He does not even open his mouth. How would he inhale the nitrous oxide? So for its use is very limited to a mildly cooperative, or those who can sit in the chair but they're a bit afraid. This can give them a bit of relaxation. Now those who do not really cooperate at all, we have to put them asleep. That is general anesthesia. We book the child for a surgery to make the fixing of the teeth. This clinic has every possible facility that we need to provide the necessary dental care for the children. In terms of dental materials that we use, different type of materials specifically is made for children. You can find it in this clinic. Certain material that we don't find in other places, it is available in our clinic. The other thing is the setup of the clinic, the design. There is a TV mounted to the wall of the clinic. This can give a little bit of distraction to the child. They can enjoy watching some movies while they are on the dental chair. There is a dental camera that's attached to the chair that the child can see the cavities and realize how bad is he doing to his teeth and how bad is it needed for him to do the treatment. So this is a psychological effect that gives an environment for the child to help us do the treatment. Yes, we do examine and assist the parents to realize that the child needs an orthodontic treatment or no. If they do need it, then we refer them to the orthodontist specialist in the same clinic, because we can't do orthodontic treatment, but we can help them identify the problem if they don't know about it, and then they can have an early intervention to prevent further damage later on. Losing their baby teeth, for what reason? If it's for they're getting old enough to get rid of the baby teeth, that's very common. You don't need to panic about it. Just leave it. It will come out by itself. Now, there are cases when we have double teething. The permanent teeth are coming out and the baby teeth still there. At this stage, we need to take out the baby tooth to give a chance for the permanent to come out. At an early age loss of a baby tooth, there must be a reason behind it. It's like if you talk about 3-4 years old, the child losing his baby teeth, that's not normal. We need to look out for the reason. If you look at 7-6 years old, 8 years old losing his front teeth, that's very normal. We don't need to panic, just leave them to come out. Even a lot of parents ask, if I leave them, they are wobbly, they might swallow them. It's okay. There's no worry about that. If you can take them at home and it's easy for you, you can do them at home. If it's very difficult and very hard to remove them, you need to have a dental visit and take them with a dentist. This group of children usually they reach a stage where they don't really take good care of their teeth, and I see a lot of teenagers with serious issues in their dental hygiene, and most of them they want to do braces at this age. They don't take good care, they need braces, so they don't brush and they want braces as well, and they insist to have braces because their friends do have braces. So I would recommend a 6 months or 4 months checkup in this age to make sure that no cavities are developing, because parents cannot control them, unfortunately, and they don't brush. Definitely, I always tell the parents that teenagers are very critical, like the 3, 4, 5 years old. 3, 4, 5 years old, they eat a lot of sweets, a lot of sugar, they don't brush, and the same, the teenagers, they want to live their life, but they don't care of their teeth. So I insist on the parents to bring them 3 to 4 months to have a dental checkup, not 6 months. They don't want to go to the, to the dental office. Well, there is a part on the parents. They persuade them, a lot of promises, a lot of gifts. Maybe we take the, go to the dentist, we'll take you there out.
But not sweets.
Not sweets. Not sweets, definitely. It depends actually on the child, but the majority come with sweets. But as soon as they convince them to come to the dental office, then it's our part to help them on that. But how to bring them to the dental office, it's a parental technique.
Job of the parents.
The job of the parents. When they come, as soon as they come to our clinic, we will make sure they leave.
You take over and put them at ease.
Exactly.